In cases of otitis media, treatment is around the infection of the middle ear. So typically they would require antibiotics. Typically within few days, you should have improvement. But let's say after 5 days of completing your antibiotic and still there's no improvement, then you need to admit and give IV intravenous antibiotics. Within 24 to 48 hours of IV antibiotics, it should show some improvement. So in some cases, when IV antibiotics does not work, child still has pain, still bulging drum, is waiting to burst, then you need to bring the child in to the operation theatre and make a small nick over the drum to put in a ventilation tube. What's this purpose of the ventilation tube? Basically, it sits on the drum with its posterior end on the middle ear. So it improves back the pressure difference between the external and middle ear. It drains the fluid outside and makes this area back again, being its normal middle ear status. Once it serves its purpose, it dislodges itself outside. So you won't even be able to see it because it's so small. It's just 1.3 centimeter in an adult and 0.67 centimeter in a child. So even if it dislodges further, you won't be able to see where it drops. Or sometimes it just dislodges into the external ear and I'll pick it up when you come for your repeated follow-up. Okay, then what happens to your drum? Your drum seals back. There won't be any residual perforation because that's how small your ventilation tube is. So the relief comes immediately after inserting the grommet. Typically, when the patient wakes up from anesthesia, they're like, oh, I can hear. Oh, no more pain. So sometimes it's even done as a daycare procedure. You do it now, you go back by noon. That's how safe the procedure is. In children, there might also be a large adenoid sitting down there blocking the eustachian tube. So then, if you need to do a myringotomy grommet, grommet is basically the ventilation tube, then you need to address the adenoid also. Or not, you're treating it partially, meaning you're only addressing this, but the blockage here you're not addressing. So you need to address this as well, so that the fluids can drain in from the nasopharynx into your throat and you swallow it, instead of coming in up here. In an adult, most of the causes is not otitis media alone, but is also linked to sinusitis, polyps, or in worst case scenario, tumor sitting at the nasopharynx, at the back of your nose. So this needs to be also addressed because whatever infection from the nose will keep on trailing back into the ear.